this is our main reception area where all the patients come to these two windows to check in with our main, with all our receptionists, and then they just sit out here and the nurses or the practitioners will call them out from this area. We do have an independent lab that works in our clinic where they're a bleeding station, so they only draw bloods. They do ECGs, Holter monitors, and then we also have a tech that comes once a week to do venous Dopplers, echocardiograms. He comes on Mondays. So
how does that funding for the lab work?
They are private, independent of us. They're Canadian Medical Labs, so they rent the space from us. Yeah.
Terrific.
Yeah, and then their reports go directly downloaded electronically to our medical record program, so it's just awesome. Yeah.
Terrific. And does it serve people other than your patients?
Mostly our patients, but they will do ones outside of the practice. Yeah, it's hard because it's difficult for them to get those reports to those doctors, but if a specialist in London orders a test and that patient is one of our patients, they will do that and send the result to the specialist in London and to our family doctor.
So how many doctors are there in Clinton? And
we have 5 family doctors right now
in this
building. Yep. And that's all. Every family physician in Clinton is within our team. Yeah.
Oh yeah.
Yeah. So
you're accepting new patients now?
On a very limited basis. We did just have 2 physicians leave.
Right.
So that has really limited, a lot of our physicians have taken on some of those patients.
Right.
But we're still working through that. So not taking on a lot at this time, very restricted.
But you've got...
But actively recruiting.
Actively recruiting physicians, definitely. We always are. We do have 2 nurse practitioners.
Right.
One is just a new grad that started with us in November. And we have a dietitian, a social worker, a mental health worker, a psychologist, and a child psychiatrist that also work with our team.
So how much of the child psychiatrist time do you get?
We get 1 day a month with him. And actually we do that, and when we go downstairs, I'll show you, we do our child psychiatry through telemedicine.
Oh, you do?
Yes. Yeah, so it works out wonderful.
So you're hooked up to OTN here?
Yes, we are.
Fabulous.
Yeah, we love it. We use it a lot.
You do use it a lot, eh?
We
do
do.
You use it mostly for?
Mostly for education. We have been running some programs with the Canadian Diabetes Association for diabetes education in the evenings. We've done a set of 2 evening programs now, and there's 2 more coming up in the spring. We do it education for our staff. We just did a violence in workplace in-service, and what we did is we taped it using the OTN, so then all of our staff can go to the OTN website and view it. 18-month enhanced well baby visits.
Yes, you do that.
We've been using the OTN project to videotape presentations from the providers that we refer to, so whether it's CAS, Small Talk, CPRI, they're all coming up here doing a quick little video presentation, archiving it on the OTN, and then any nurse practitioner, if I give them the password and the username within the Hearing Perth area, can then view what those people do and what the referrals. So we've really been using it a lot that way. We've done 1 referral visit with a physician from Toronto, which was really kind of neat, and we're kind of trying to move more into that. It's hard to know who's on and who's not on right now, but it's good.
I think there's huge potential to do so much more with OTN.
Definitely.
So much more.
Yeah.
And the hospital is hooked up now to the diagnostic imaging, right? Swoden?
Yep.
Southwest Ontario Diagnostic Imaging.
Yeah.
Through OTN as well.
Oh, okay. Yeah.
So
great.
That means any diagnostic imaging done there can be read by a specialist in any other hospital in Southwest.
Right. Excellent.
So
good.
Yeah.
Okay, we're just going to go this way and see our social work room. So the reason.
So do you do the prenatal ultrasound?
No, they go across the hospital.
Okay.
Yeah. So this is our social work mental health counseling room. We really wanted to set up that it was just relaxing with the love seat and the chair, and just more of an intimate spot for when they come to visit, put some more at ease. And the reason why we put it at the back of our laboratory was no one knows they're coming back here to see social work. In a small town, everyone always wants to know who's doing what and where they're going. And, oh, I saw you at the clinic. What were you doing? Oh, I was just going into the lab. So no one knows that, unless they've been in this room, that this room is back here. And it's really worked well for privacy and confidentiality issues. So.
Great.
And our staff really like it. Our mental health worker was going to change her day that she worked in our clinic and decided to go back to the Fridays so she can use this room.
Oh, is that right?
One of the reasons. There was other ones too, but.
So you've got, so tell me, you've got a social worker, how much?
0.8 social worker and then a 0.2 mental health worker.
So
to
4
make
days
up
a
our-
week social worker?
Yep, yeah.
And then, sorry,
1 day mental health
one
worker.
day mental health worker.
Yeah.
That's fabulous.
Yeah. Yeah.
Would you have had that here in Clinton before?
In private practice, probably not funded
Right.
for access for everyone.
But it would have been disjointed and difficult.
It would, and it wouldn't have been connected with the physicians at all. It would have been a private practice outside of the clinic and never shared information back. Whereas here, our social worker and our mental health worker chart on the same chart as our physicians.
Oh, they do?
Yeah,
Yeah, so,
yeah. So it's seamless.
and that's what my constituents love.
Yeah,
Yeah.
yeah,
That they can access all that and it's
Yeah.
holistic care.
yes,
Wrap around.
yeah,
Yeah,
exactly.
That's what they like.
Yeah.
Great.
Okay, so we'll move back out this way. Yeah. All the doctors were actually in this building before we became a family health team. So all the artwork, we're actually an art gallery for a local painter. One of our physicians' wives, Susan Hay, does all the artwork for us here. Yeah.
Oh, that's great.
Yeah.
And it's actually for sale.
It is. It's for sale. Yes. Yeah.
Perfect.
So this is what we call South Pod.
Yeah.
So down this way are all just exam rooms for each of the physicians. Actually, we can go into this one. So this is a very typical exam room. Has access to the computer system. Has a printer in it because we print off our prescriptions. We're really hoping to someday be able to just
E-prescribe?
e-prescribe off to our pharmacies, but for right now they print off the prescriptions. Usually each of our physicians have 2 exam rooms and our nurse practitioners have 1 each. The next room over here, this is our dietitian.
I recognize.
Yeah, this is our dietitian's room. So she
very
sees
good.
not only diabetics in here, but all sorts of different different people for different issues, whether it's weight loss, whether it's hypercholesteremia, high cholesterol, high blood pressure. They've had a few referrals where someone's got cancer treatment and they're going into treatment, so let's help them out with their diet before they go. So that's our real goal of again, the holistic care of catching them before there's issues. And
So if people are part of a program here, they can keep coming back to, they can
follow up with
follow up.
Yeah,
That's great.
Yeah, our previous dietitian ran a program called Healthy You, which was a group program, and now our new dietitian is doing some of the follow-ups from those patients, and she can't get over how successful that program was.
Great.
She says, "When can I run it again?" And I said, "Well, not in the winter." I said, "Well, to the spring, and when we have no travel issues."
right, yeah.
But yes, she uses a lot of food models and a lot of handouts, hands-on stuff with the dietitian.
Good.
So how big a geographic area do you cover if you mapped out your patients?
If we mapped out our patients, my little blurb on the website says we see anyone usually within Huron County and Perth. We have people as far as Walkerton.
Oh, you do?
The odd person who still wants to come back. Or
So that would have been
London.
somebody who
Used to live here and then moved and then kept coming.
Right.
So we have almost 9,000 patients at the last count that I had. So
And a
that's-
significant number were previously unattached.
Yes.
My note
Yes.
said.
Yes. Yeah.
Yeah.
Yeah, especially when we did have the 2 new physicians come,
Yeah.
who have unfortunately subsequently left.
Yeah.
But we did roster a lot of new
Well, the
patients
new
at the
medical
time.
school grads, as you well know, love this model.
Yes.
Love
Yeah.
this model.
Yeah.
So
Yeah. So we're really hoping to recruit this spring again. There was one. We've done some tours and there is some interest. So
Yeah.
really hoping to recruit and
it's
get
no
another
better place to
physician here.
live.
Yeah.
If you can't live
For
in
sure.
Brooklyn, you maybe want to live in Clinton.
So if I just sneak out before you here. So I'll just take you, everything in our clinic goes in circles so no one can get lost. They always end up in another circle. So we have, these are small dictating rooms where our physicians go between patients and just go and they can take a phone call, they can do dictating of a note or typing of a note or whatever they need. So again, challenge them, and again, these are just more exam rooms. This is one of our nurses' stations. We have one on this side and one on the other side. So this is where all of our immunizations are kept, our dressings, our supplies. The nurses each have a section here where they can work on their computers because everything, again, is all integrated.
Yeah.
So weighing in our babies, giving immunizations, drug samples for those that can't afford them. So instead of having individual offices for each of our physicians in our allied health, we decided we would do one group room. So everyone has their cubicle, and then if they're working with or they're working with a patient and they have a question, they just roll their chair back, and it's very easy for them to ask someone for their opinion on something. This is Jessney, our new dietitian.
How are you? Very nice to meet you.
We are.
How are you?
We've recruited Jessney from Toronto into Huron County.
Very good.
So,
Good choice.
yeah.
Very excited.
Yeah.
How long have you been here?
For about a month. I moved to Clinton, not far from here, so about 2-minute drive.
Perfect.
So it's
It's a nice
great.
change.
This is Dr. Hay.
Hi there.
How are you?
Nice to meet
Deb
you.
Matthews. How are
Hi,
you?
Carol.
Nice to see
Welcome.
you.
Dr. Hay is our lead physician for the family health team and on the board, so he does lots
Means
of...
I sign lots of paperwork.
I
Yes.
bet you do.
forever.
Wouldn't think about that, would you?
Oh, no.
I have my own little special spot on his desk where I set it all, so
Right.
there's always stuff to sign. So
So you're getting the tour?
Yeah, I'm just interested to see. It's interesting, different family health teams
sure
really
they
are
are.
very different.
yes, yeah.
But you're all co-located here, which I think is great.
Yeah.
But different models work different.
They do.
Yeah. Yeah.
And you were the wave one, so you were right
were.
the pioneers.
Yes.
Number 9, I believe, in the
Yeah.
province.
Yes.
We were right up to the top. That was our family health network, actually. Our teams were fairly early, too. Carol's been a very staunch supporter and extremely helpful.
So the difference between what you had before you were a family health team, and now that you're a family health team, how would you describe the differences?
Well, the difference before, we were all individual practitioners, and we had actually engaged nurse practitioners before, but other than our nursing staff, clerical staff, we didn't have any other allied health professionals, and we didn't work as cohesively as a group. So now we're one big happy family, and I'm sure you've heard this from other physicians and individuals in family health teams. I don't know how we could go back without the allied health professionals, especially the mental health professionals.
Yeah.
There's something that not the family physicians have a great deal of interest or skill. We sure don't have the time.
Yeah.
So that's just, I don't know how I did it before, but it's much, much better. Patients are far
People
better
probably
served.
just didn't get the care they needed, right?
They really didn't. Well,
Yeah.
we would...
You do your best.
We would send them off to various other agencies, but now it's all in-house,
Yeah.
and it's
Yeah.
quick, and there's no extra cost, because it used to be mostly private pay, so if you didn't have the money, you didn't get the service.
Yeah.
And that's not consistent with how we like to do things, so... And that's been the biggest change.
So your nurse practitioners, what do you have? What's their role here, as opposed to the RNs?
Well, nurse practitioners have a much greater scope of practice. So
And they can use their full scope of practice
Yeah,
here?
and they do, and that's what sort of happens in here. We have the physicians try to be as accessible as possible, so when the nurse practitioners find something that's beyond their scope of practice, then they can ask us. And in our setup, the nurse practitioners don't follow their own patients. They see the patients that are rostered with the physicians.
Okay.
And that's their preference. In some teams, the nurse practitioners have their own
Right.
roster, and that works for them too. And we've offered that to ours, but that's not how they want to do it.
So when someone calls to make an appointment, they've got a baby with an ear infection.
Right.
they think it's an ear infection, and a nurse practitioner can see them.
Right.
Do they still get scheduled with a doctor, or
No,
can you schedule the NPs?
It totally depends on who's available. If the
Okay.
physician has openings, we'll fill the physician. If the nurse practitioner has openings, we'll
Okay,
give
so
it to the nurse
they have
practitioner.
their schedule too.
Yep. Yeah. Yeah.
And our nurse practitioner actually has a time slot available for acute care, because it's hard to get in to see physicians.
Right.
Because we're quite fully booked. So the acute stuff, the nurse practitioners often will look after. Although if they can get in to see their own doctor, they will, for sure. Well, the nurse practitioners do a lot of well women care, and that's something that's hard for us to fit in, and frankly, they're more comfortable many times to seeing a nurse practitioner who tends to be female.
Yeah.
Not always, but in our unit they are, so that works out nicely too. But they do a wide, they have a wide scope of practice. There's not a whole lot of stuff they can't do.
No, we've got
That,
nurse practitioner-led clinics now.
Yeah,
Where,
well,
yeah, so it's
I won't get into that one. I'm not sure if that's the way to go, but certainly it's a model that works
Yeah.
in some places.
yeah.
Yeah.
As long as everybody understands what their scope of practice is, right?
Exactly. Exactly. And we've had nurse practitioners in the clinic for quite a long time now. That the physicians are really comfortable with the scope. The nurse practitioners
Yeah.
are comfortable with the scope, and the other staff know also.
To give Martin Bokout credit, he brought in a nurse practitioner long before
Yes.
the whole primary care reform started. He brought him in his own pocket.
Yeah.
I've been singing its praises for quite a while. I don't know, how long have we been at Family Health Network?
Family Health Network, I think
7 years?
2005. Family Health Team 2006.
Yeah.
Renovation 2007.
And you're all electronic medical records?
Yeah, and since we've been on it for 5 years now, it's really useful, because longer than 5 years there's not a whole lot of stuff that's all that
Relevant.
helpful.
Yeah.
But now there's enough data to
Yeah,
make it.
exactly.
Yeah.
Exactly right. The first couple of years, you're kind of always running back to your paper charts, but
Yeah.
we seldom do that now.
And you're connected to the hospital too, I was hearing, which
Yeah.
is fabulous.
That's fairly new, but that's very slick. I'm always pushing for that, to try to keep the paperwork to a minimum and move stuff electronically. I was on my soapbox at lunchtime today.
Yes, which got me thinking about possibly working with having the DEC have access at the
Why not?
hospital,
Sure.
to our system at
That
least,
would make a
and
lot of
then
sense.
that maybe move ahead what they can do with their system.
Talking about the diabetic education
Yeah.
system in the
Yeah.
hospital. So.
Talked about it earlier.
Yeah.
Great, well, wonderful to meet you. Thanks so
my
much for
pleasure.
what you're doing here.
Oh, great. Thank you,
Okay.
Carol.
Okay, we're going to go downstairs and show you our basement. About a year and a half ago now, the Hospital Foundation actually owns this building.
Okay.
So they decided that we needed to be able to use the basement
Yeah,
much
was it a
more
basement
efficiently.
before?
No, it actually had a dentist in it
Oh,
at one
okay.
point. And then when we did our renovation upstairs, we accessed this area down here to be able to keep functioning for the family doctors. So we created this very large meeting room. This is where we have our staff meetings if we do an in-service. The Canadian Diabetes programs that I was
Yeah.
talking about, that OTN is done
Sleep
here.
clinic.
Sleep clinic, yes, yeah. And then we
Great.
have,
So you run a number of different programs.
yes, yeah, we actually have Alzheimer's Society meets here once a week.
Yes, great.
So, meeting room, and then this is our OTN.
Okay.
So if we're just doing a patient consultation over OTN, they use this room. If we're doing a larger group, we can hook it up in the big room, and we can also hook it up into our smaller meeting room too. So we just love it. It has been helps accessibility for us, for sure.
Very good.
Yeah.
Yeah,
Yeah.
This is
Yeah.
one of the best things.
Yes.
Yeah,
It is.
really is.
Yeah.
Because if patients can see a specialist through OTN instead of traveling to London or
Exactly. And we do have a couple of exam rooms down here too that aren't really used too much yet. Our tech that comes to do the echocardiograms and venous Dopplers and stuff, that's his room on Monday, but we do have some room to grow, which
Great.
is kind of nice. And this is all wheelchair accessible through ramps from
Oh, is it?
outside. Yeah, so
Okay.
it works out well. And then through here is one of our made our physicians and our locums very happy when the foundation created this area.
Oh, lovely.
We call it our locum suite. So when the doc is on call and emerge at night,
Oh,
they
it's
can come
actually
over
a little-
here. It's like a little bedroom and sitting
Isn't
room.
that fabulous?
Yeah, so they can come over here and sleep. They have access to a phone. The hospital can call them. And they just, they have their own shower, bathroom, little kitchenette.
Oh, that's
So
terrific.
it's been awesome because with our docs being on call more often, when there's fewer of them now, and just being busier in
Yeah.
our emergency department with the issues with Seaforth being closed at night,
Yeah.
our numbers have increased. So lots of times they can't get home. But if they can come over here for an hour and at least get a bit of sleep,
So this is open to any of the docs who are on call across
Yep.
the street?
yes.
Ah, so
Yeah.
you have to book it?
Yeah, well, there's only one on call a night.
Oh, there's
so.
only one on call at night. Okay.
Yeah, so, but it's been a great asset, and I think it's probably used 3-4 nights a week.
That's
So-
great.
It's very good.
And then you
Yeah.
ask them to strip the bed.
So then we know someone slept in it.
Oh, that's great. Oh,
So-
that's a real bonus.
Yes, yeah.
Yeah. Very comfy too, eh?
It is, yes, and everything was donated from local community
Businesses and-
businesses.
yeah?
Yep. Yeah. So, yeah, it's great. So that's the end of the tour. So we can go back up to the reception area, and if you have more questions, or there's other media up there that might have questions.
Beautiful.
And,
Okay.
okay.
Well, ladies and gentlemen, always a pleasure having Top Guns in a community. Our MPP is, well, she's brought another Top Gun with her. We have two honorable ministers with us tonight. Here is Honorable Deb Matthews, Minister of Health. I need to tell you, George did an awesome job.
Oh, George is fabulous.
I know. I mean,
Yeah.
some of the promises and things, we kept him to his promises, but we really didn't have to. He did an awesome job.
Absolutely right.
And Carol, you know what I'm talking about.
Yes, absolutely. And when George was here, he the pilot project for Blue Water Rest Home, and also all of our family health teams. You know, Minister Matthews is here today to hands-on, on the ground, talking to our family health teams, and what a wonderful mix they are, and how well they serve my constituents.
Well, honorable lady,
Fantastic
Thank you.
job as well.
thank you.
I'm no
Thank
George.
you.
I wouldn't
No.
even try to be George.
I just want to say, this is really unique. It's about Christmas time, folks. We have about 3 weeks to Christmas, 2 weeks, and it is always nice to be graced by a minister to come and follow through. Well, on the idea is to see if everything's actually delivering and working, because we know that when the ministry knows how these rural areas function, it can open new doors for a better future for all. And I know the strategy our MPP here, Honorable Carol Mitchell, has done an awesome job in the community. And I can't thank her enough to have brought you to us to see some of the things that are happening in these rural hospitals. And here is another example of a facility that is really delivering. Throughout the entire county, in fact, the entire Ontario's west coast, has got a lot to brag about.
No, that's absolutely right. And I tell you, you couldn't have a stronger MPP than you've got in Carol Mitchell. She makes sure that everybody down at Queen's Park understands what's important to her constituents here. She takes her job very, very seriously. She does it very, very well. I'm proud to work with her, and I tell you, Ontario's a lot better because of the work of Carol Mitchell.
You're not going to get too many people disagree with you in this community. However, I want to thank you, dear lady, for coming and gracing us with your presence here as a minister of a very important portfolio in Ontario. It is a privilege talking to you, and certainly I don't want to go into issues. It's Christmas time.
I wish
know
the
you're-
opposition felt the same way.
I know you have your tables full, and there's a lot of people to care for in Ontario. Ministry is delivering on some of those issues that have been on a back burner, in fact, been brought to the front and dealt with. However, as things follow, it's not the easiest portfolio to handle. But here you are, and this is how I'm impressed. When a minister comes and rubs shoulders with communities such as ours and wants to know firsthand what's what and what's not,
Yeah.
how we best deliver this care we're talking about in Toronto, this is impressive for me.
Well, I'm delighted to be here. You know, we're always learning about what we can do better, and I think it's useful too to take a step back and see how far we've come. And these family health teams were just an idea just a few years ago, and now we've got full care for people here. We've got social workers and mental health workers and a number of different allied health professionals working here. So when people come here, it's not so much anymore about treating them when they're sick. It's about getting them and keeping them healthy. So for me, that's what health care is. It's let's keep everybody healthy so that we don't need to use our sick care as much.
Feds are telling us about the importance, well, we're an aging population in Canada. And it is refreshing to know that Ontario government is paying high attention to our health care. There are things, needs and wants are plenty. And there's all kinds of us in these communities. Some needs that, you can't come through for everybody all the time. But by and large, when one pays attention as to where we are and where we could have been, I don't think we've got anything to complain about.
Absolutely. We've come a long, long way in 7 years. We've got a lot done, and I'm proud of the progress we've made, and I'm excited about the progress that we're going to be making. Honourable
Deb Matthews, thank you for coming. And our Honourable Carol Mitchell, thank you for bringing her to us.
It's my pleasure to bring Minister Matthews into the riding anytime. I can tell you that she works very hard, and one of the skills that I believe is her greatest strength is her ability to get on the ground working and listening to people, and her ability to adapt and to go in and take a snapshot of time and have such a strong understanding. And I can tell you that that's a skill that's not held by many, but it is held by our minister. And I'm quite proud of the work that she has done.
Refreshing thing to see, let me tell you, because I know you've got other things to do, and as a ministry, it's a huge portfolio. You've got all kinds of work to do in Toronto. Thank you for coming to us.
My pleasure. Couldn't be happier. Thank you.
Thank you.
Dan.
Thanks so much.
Thanks, Dan.
Thank you.
We'll see you.
Good night.
Bye-bye.